we took care of the infectious issue. Your pneumonia seems to be better, but we need you to we need to prevent future infections, which is why we're not letting you eat by mouth, because the swallow specialists said that you were not very you're very high risk of aspirating anything that you eat or drink, and we do not want you to get another pneumonia and then get set back even farther.
Right.
We cannot afford that in terms of getting you to the study. We also want to make sure that you do get some nutrition in the meantime, which is why the next best thing, as unpleasant as it probably sounds, is having that tube placed in your nose. And I assure you that once it's down, most patients don't really complain about those. You kind of get used to it, and then we can give you nutrition through that tube so that your body can, recover from these various insults and can start healing from some of the short-term, non-lymphoma problems. The other thing is we need you to be more physically, we need to give you the best chance that you can have of becoming more physically active, because again, the treatment will knock you down. We don't want you to start from can't get out of bed to really sick in bed. We want to get you to the point where you're actually closer to your normal functional status, so that when you kind of get tired and get the effects of the chemotherapy, maybe at worst you just go back to kind of mainly being in bed, but not so weak. So to do that, that's why we had the spine surgeons, not saying that you're necessarily going to have surgery, but we had some of the spine specialists evaluate you, because you had that one of your vertebrae, you probably heard, is really just flattened, and that's probably from the lymphoma, and that's causing pain when you get up. And we want to ask them if there's any kind of tolerable procedure that could be squeezed in between your chemotherapy that would help you feel better and maximize your ability to be able to get out of bed, walk, that sort of thing. So I would say that with the goal of getting you to the trial, we're trying to give you every chance we can to help you meet some milestones that are required, namely better nutrition, no infections, and more functional. Does that make sense?
Yeah. Except for what's food?
I'm sorry?
Is food stuff
Yeah.
in your mouth?
So the food sorry, I kind of gonna sneeze. I just want to
Oh.
sit off for a second.
He's got to sneeze.
You're good. Yeah, fast. Food is going to take the form of liquid with nutrients in it, which is going to go through a tube that goes through your nose down to your stomach.
But that could build him up quicker than, because he
Yes.
hasn't wanted to eat much,
Yes.
So that's going to strengthen you more.
That would be better than no nutrition,
Right.
and it would be better than taking an unwise risk in having you take things by mouth, and then
And
what would
aspirate,
probably happen
get
is that at some
pneumonia.
point you would get a pneumonia.
Again.
Will have any taste?
You unfortunately will not taste any of that. It'll just go into your stomach.
Bummer.
Yeah.
But only for a time, just until he's built up.
Yes. I think that if you can get stronger and mobilize, I think that as your body recovers globally and you get stronger, that will maximize the chances of you regaining normal throat and mouth function and your ability to safely swallow. Your intermittent confusion will lessen. That will reduce the risk of aspiration as well.
Good. What's the confusion from? Is that part of the?
I think it's a combination of the fact that he's just been so sick for a long time and in the hospital in an unfamiliar environment, the fact that his calcium had been elevated, and that can cause confusion, the fact that he's on steroids to kind of just keep the lymphoma at bay temporarily, which can cause confusion, and the fact that not really anymore, but previously because of episodes of more impulsiveness and things, in order to keep him safe, you've been given medicines that sedated him a little bit. But there's always a initial intended response to those medicines, and then there's a delayed unintended response. So it's like we can make someone calm and safe in the short term, but then you kind of pay for it later, because then it takes them a while to kind of get put everything back together again.
Yeah. Interesting. Okay.
Okay. All right. Any other concerns that you have today or questions?
No, let's
What about his lips and his mouth, and he's
Yeah.
dry, so he can't drink,
Yeah.
so what can we do?
Yeah, so the
Yeah.
we did have the oral medicine
Right.
doctors see you, and there are a couple of things that they had advised. One is that we're giving you an antiviral medicine because in the setting of immune suppression from the steroids and the previous rituximab, patients have a tendency to have latent viruses reactivate, and so there are some viruses that can reactivate in the mouth and cause ulceration. So you're being treated for that. Your immune system is still a little bit depressed. So you need help in healing your mouth. As far as your lips go, part of that's related to probably the virus, but part of that is perhaps from being dry. So the challenge is that in order to improve your lung function and get you off of oxygen, we wanted to dry out your lungs. But that kind of dries out your lips a little bit too. So we can maybe give you some, if we haven't already given you some like lip balm or some moisturizing
Yeah,
thing, we
we've
can do
been
that.
doing that.
You
yeah.
have, okay. But in terms of like when will the underlying issue go away? I think we need to treat the virus more, and once we start the nutrition through the tube as well, that will help just anything in your body heal. And right now your mucous membranes are just damaged from the immune suppression, the virus, and the lack of or the lower nutrition.
Okay.
Okay. All right.
Is he still gonna get the chemo today? I mean, does
That
this
is
change
that
that?
is the, no, that's still the plan.
That's still a plan,
Yeah.
okay. And the bone marrow?
Bone marrow biopsy.
Biopsy.
Dr. Davis, I had been told that Dr. Davis will come by at some point this afternoon to do that.
Okay,
All right.
all right, thank you.
Good to see you, and
Nice to meet you.
yeah,
And
you
wow.
do seem more awake today than in other days, more engaged.
I'm almost there.
Okay. All right.
He's
Hopefully we can get all the way there.
he's hopeful. He was real excited that he could get the chemo.
Yes. Yes.
That was good.
Great.
You've been looking forward to that news.
Yes. Okay.
Thank you
All right,
very
good
much.
afternoon.
Okay, bye-bye.
What am I with? Water?
You can't have water either. Because when you drink water, it's going down the wrong pipe. And then you're getting water in your lungs and outside your
Oh,
lungs.
really?
So you can't do anything. But you can squish it around your mouth. You can put that around your mouth, but then you gotta spit it out. Yep.